assignment of safety health environment. Our group consists of Inten, Ayuning, Ghaisani, Islamia Nuraini, and myself, Naufal. In this PowerPoint, we would like to discuss about the title given to us about the correlation between psychosomatics in coronavirus pandemics in 2020. In the PowerPoint, we explain about the psychosomatics in definition, symptoms, and how to overcome, and coronavirus about its definition, symptoms, and how to overcome it. This is the poster that I create about the correlation of psychosomatics with COVID-19 coronavirus. First, the COVID-19 pandemic did not only affect the mental health of the general public, the policy of physical restriction made many people have to do activities not as usual due to the laid-off. Many people began to feel tired. At the level of the older group, this policy also impacts cognitive decline, dementia, making them more anxious, angry, stressed, and anxious. Meanwhile, health workers work harder due to the number of patients exploding at the same time. The Center of Disease Control and Prevention (CDC) says the pandemic risks raising mental disorder, especially for survivors and health workers. They are very likely to develop depression, anxiety, and post-traumatic stress disorder or PTSD. Okay, first, what is the psychosomatic? Psychosomatic means psych, and that means mind and body. Soma. Psychosomatic disorder is a disease which involves both mind and body. Some physical diseases are thought to be particularly prone to be made worse by mental factors such as stress and anxiety. The psychotic symptoms usually didn't last long, it disappear and move around. Tips to overcome psychosomatic disorder to the coronavirus is first to look for a reliable source of information, take a break from the coronavirus news, communicate with loved ones, and maintain a good health and personal hygiene. And don't forget to wash your hands.
Okay, here I want to present about the definition. Psychosomatic is a condition or disorder in which with the mind affect the body and causes physical discomfort. Psychosomatic comes from the two words. The first is mind, means is psych, and the second is body, means is soma. With mind acting and the body until the disease occurs or worsens. And the second definition about the coronavirus is a large family of viruses that cause disease, ranging from the common cold to more severe illness, such as MERS and SARS. Cause most coronaviruses are harmless viruses. The meaning of corona is hello, that's in Latin words, or crown. The spread of coronavirus is the same as other flu-causing viruses, namely from coughing and sneezing or from the touch of an infected person. The virus can also be transmitted if you touch contaminated items, because then you touch your nose and eyes, also mouth, without washing your hands. You will get infected of coronavirus. Psychosomatic symptoms. The psychosomatic symptoms has 7 criteria. The first is stomach or heartburn. The second is back pain. The third is toothache. The fourth is headache and migraines. The fifth is breathe quickly. The seven is the sixth is palpitation. The seven is shaking. The last is sweat. This is if you have the criteria about the psychosomatic symptom. There are the criteria. And then the symptoms of coronavirus infection. First, people who are infected with this virus will show different symptoms. Symptoms of a coronavirus infection usually depend on the type of corona and how serious infection is. And the second is it can be runny nose, headache, cough, sore throat, fever, not feeling well. Overall, other types of coronavirus can cause more serious symptoms because this infection can lead to bronchitis and pneumonia, especially in people from the noisy group. Some of the more severe injections due to coronavirus are those that are generally more common in people with liver and heart problems or people with weakened immune system and old persons. So, how to overcome coronavirus in our body? The first is wash your hand with soap and running water for the 20 seconds. And the second is avoid touching the face, include nose, mouth, and eyes with dirty hands. The third is avoid contact with sick people. The fourth is avoid areas where infection or outbreaks occur. The fifth is clean items that you touch frequently. The sixth is cover your mouth when coughing and sneezing with a tissue and wash your hands immediately. And the seventh is stay home if sick. And the last is social distancing by limited activities outside the home and contact with others, because this is really effective way to reduce the risk of transmission and flatten the COVID-19 pandemic curve. And then how to overcome psychosomatics. Here I wanna discuss. The first is psychotherapy, one of them with cognitive behavioral methods, relaxation or meditation practice, radiation technology, acupuncture, hypnosis or hypnotherapy, electrotherapy. Means electrotherapy have transcutaneous electrical nerve stimulation, means TENS, and physiotherapy, and the last is medication such as antidepressants or pain relievers prescribed by a doctor.
So I am Inten Ayuning Ghaisani and I want to discuss about what is correlation of psychosomatic in this coronavirus pandemic. So the COVID-19 pandemic incarnated terror for many people to the point of causing mass paranoia. Psychological and physiological conditions disrupted due to bombarded news about these outbreaks. Symptoms that appearing similar to SARS-CoV-2 infection such as fever, sore throat, and cough. Some of us today may feel complaints related to fever, headaches, and sore throat after exposure to news or events related to COVID-19 infection. And this reaction problem arises due to anxiety and is commonly called a psychosomatic disorder. Psychological problems are psychological compilation effects that affect psychological function. This can occur because there is damage to physical organ due to undue activity of the unconscious nervous system and the biochemical response of the body. When anxious, the amygdala, the brain center of stress, responds by activating the autonomic nervous system excessively. The body is made to face challenge, so always be alert. Discussing psychosomatic feeling arise, denying and increasing blood pressures, and creating pain in the chest. Stigma exacerbates mental disorders. Meanwhile, health workers work harder than the number of patients exploding at the same time. The Center for Disease Control and Prevention says the pandemic has the potential to cause mental disorder, especially for survivors and health workers. They are very likely to develop depression, difficulty, and post-traumatic stress. We can distinguish psychosomatic symptoms with the characteristic of symptoms disappearing arise, not continuously or move around. World Health Organization recommends steps to minimize anxiety that affects the mental state at the time of the outbreak. First, reduce news exposure about COVID-19 as much as possible, access to reliable news sources, and increase access to positive news. Second step is to make routine schedule of activities to do at home. or do fun new things. Keep in touch with family and friends by social media. Do a regular exercise, maintain sleep patterns, and eat healthy. Many people experience psychosomatic amid coronavirus outbreak. Psychologists say it is natural that people experience psychosomatic disorder, namely physical health disorder due to psychological pressure in the midst of an outbreak of COVID-19, which has claimed more lives in Indonesia. It is natural for people to experience anxiety and worry. This psychological pressure can further affect physical condition and have an impact on decreasing immunity. In this condition, a person can feel as if he is not feeling well, and the symptoms that appear is similar to the symptoms of illness of concern, such as colds, cough, fever, nausea, headaches, etc. Humans will naturally respond when faced with stress or uncomfortable and threatening situations. It is very important to keep aware of development in information about the coronavirus, but being constantly exposed to information, both trusted and not, can also make person more easily panic, anxious, and stressed. Excessive worry or anxiety due to often receiving such information, which ultimately cause the body to create symptoms similar to the coronavirus. As a result, you will think you have been infected with the coronavirus. This condition is known as psychosomatic due to coronavirus. This is usually caused by stress factor that cannot be properly adapted. Then the body experiences constant pressure and adrenaline will flow throughout the body, causing psychosomatic symptoms. Here are some 5 tips to overcome psychosomatic due to coronavirus. First is look for a reliable source of information and take a short break from reporting the coronavirus and communicate with loved ones and maintain good health and personal hygiene, and also keep thinking positive.